Welcome to Medicare coverages. The big M word, it's not that scary. Let's face it, folks. Healthcare in this country, it's a bit of a mess. We've all heard horror stories about surprise bills and deductibles that would make your head spin. But fear not, senior citizens. Once you hit the magical age of 65, there's a beacon of hope in this chaotic world of medical bills. Original Medicare. Original Medicare isn't some secret society with a complicated handshake. It's a government-run health insurance program designed to help make your golden years a little less stressful, at least when it comes to your health. Think of it as a safety net, there to catch you when unexpected medical bills come knocking on your door. Because nobody wants to be choosing between groceries and life-saving medications. Now, I know what you're thinking. Government program. Must be about as much fun as watching paint dry, but trust me on this one. Original Medicare is surprisingly straightforward. It's broken down into two main parts, Part A and Part B. Think of them as two trusty sidekicks, each with their own superpowers to help you navigate the world of healthcare. Part A is your hospital hero. It swoops in to cover things like inpatient hospital stays, skilled nursing facility care, and even some home health services. Basically, if you get hit with a major health issue that requires serious medical attention, Part A is there to help shoulder the financial burden. Part B, on the other hand, is your partner in crime for all those routine checkups and doctor visits. Think of it as your preventative care pal, making sure you stay on top of your health and catch any potential problems early on. Part B covers services like doctor appointments, outpatient care, preventive screenings, and even some medical equipment you might need. Now, I know what you're thinking. This all sounds too good to be true. What's the catch? Well, like most things in life, Original Medicare isn't entirely free, but it's certainly a whole lot more affordable than trying to navigate the healthcare system on your own. We'll dive into the nitty-gritty details of costs later. But for now, just know that Original Medicare is designed to be accessible and affordable for everyone. Because nobody should have to choose between their health and their financial security. So there you have it. Original Medicare in a nutshell. It's not about complicated paperwork or confusing jargon. It's about giving you peace of mind, knowing that you have access to quality healthcare without breaking the bank. Stay tuned as we break down the ins and outs of Part A and Part B so you can feel confident navigating the world of Medicare. When talking about Original Medicare, you hear a lot about Part A and Part B. But what do these letters really mean? Think of them as two superheroes, each with their own set of powers and responsibilities. Part A covers hospital-related services, while Part B handles doctor visits and outpatient care. Together, they create a comprehensive safety net for your health needs. Part A is like your reliable friend who helps you during those big, scary times, like a hospital stay. It takes care of your room, meals, and even some home health services if you need them. Essentially, if you're admitted to a hospital or another healthcare facility, Part A has got your back. Part B is more like your everyday buddy who keeps an eye on your general well-being. It covers routine checkups, preventive screenings, and even some medical equipment. Think of it as the sidekick that ensures you stay healthy and catch any issues before they become serious. Medicare works best when these two parts are combined. They provide a well-rounded approach to healthcare, ensuring you're covered for both emergencies and routine care. It's a dynamic duo designed to keep you as healthy and stress-free as possible. Section 2, Part A, the hospital hero. Imagine you're suddenly admitted to the hospital. The last thing you want to worry about is how you're going to pay for your stay. This is where Part A steps in, like a superhero swooping in to save the day. It covers inpatient care, skilled nursing, hospice, and some home health services. Part A takes care of your room, meals, nursing services, medications, tests, and treatments. This means you can focus on getting better without the constant stress of mounting bills. Now let's talk about Part B, your preventive care pal. This part of Medicare covers services that help you maintain your health and catch potential problems early. It includes doctor visits, outpatient care, preventive screenings, and medical equipment like walkers and wheelchairs. Doctor visits are a big part of Part B. Whether it's a routine checkup, a specialist consultation, or a follow-up appointment, Part B has you covered. This ensures you can see your doctors regularly without worrying about the costs adding up. Preventive screenings are another crucial service. These include mammograms, colonoscopies, and vaccinations, which help detect and prevent serious health issues. By catching problems early, you can address them before they become more severe and costly. Part B also covers outpatient care, such as minor surgeries or procedures that don't require an overnight stay. This includes things like X-rays, lab tests, and even physical therapy. By covering these services, Part B helps you receive necessary treatments without the need for a hospital admission. Despite its straightforward nature, Medicare can still be confusing. One common misunderstanding is that Part A and Part B cover all medical expenses. While they cover a wide range of services, there are some things they don't cover, like most prescription drugs, long-term care, and dental services. Another misconception is that once you're enrolled in Medicare, you won't have any out-of-pocket costs. While Medicare significantly reduces your financial burden, there are still premiums, deductibles, and co-insurance amounts you'll need to pay. Understanding these costs can help you better plan your healthcare budget. People also often think that Medicare automatically covers all types of health services. For instance, routine vision and hearing care are not covered by original Medicare. Knowing what's excluded can help you make informed decisions about supplemental insurance or other coverage options. Finally, some believe that Medicare is only for the very elderly or those in poor health. In reality, Medicare is designed to help everyone aged 65 and older, as well as certain younger individuals with disabilities. It's a program meant to support a wide range of health needs, not just severe cases. Section 5. How they work together, a seamless symphony. Think of Medicare Parts A and B as a well-orchestrated symphony. Each part plays its own role, but together they create a harmonious system designed to cover your healthcare needs. When you use both parts, you benefit from comprehensive coverage that addresses both emergency and routine care. For example, if you have a surgery, which is covered by Part A, you'll likely need follow-up visits and physical therapy, which are covered by Part B. This seamless transition ensures you're not left in the lurch after your initial hospital stay. Both parts work together to provide continuous care. This coordination extends to preventive care as well. Part B's coverage of screenings and doctor visits helps identify issues early, which can reduce the need for more intensive treatments covered by Part A. It's a proactive approach to healthcare that benefits you in the long run. By understanding how Parts A and B complement each other, you can make the most of your Medicare coverage. This knowledge empowers you to navigate the healthcare system with confidence, ensuring you get the care you need without unnecessary stress or financial strain. Section 1. Part A, your hospital guardian angel. Remember that feeling when you were a kid skinning your knee on the playground? Remember the comfort of a parent scooping you up, dusting you off, and making it all better? Part A of original Medicare is kind of like that, except instead of a scraped knee, it's a heart attack. And instead of a juice box and a kiss, it's a hospital bed and a team of highly trained medical professionals. Now, nobody wants to think about ending up in the hospital. But life, as we know, has a way of throwing curveballs. That's where Part A struts in, wearing its superhero cape, probably with a little red cross on it. It's there to cover the big, scary stuff: inpatient hospital stays, skilled nursing facility care, even some home health services. Think of Part A as the heavy hitter in your corner, ready to step in when you need it most. It's there to protect you from the financial knockout punch that often comes with serious medical issues, because nobody should have to choose between their health and their bank account. Section 2. Inpatient care when you need the big guns. So you're minding your own business, maybe enjoying a nice cup of tea and a crossword puzzle, when suddenly, bam! Chest pain, shortness of breath. Next thing you know, you're strapped to a gurney, sirens blaring. It's enough to make anyone's blood pressure spike. But here's the good news. Once you're admitted to the hospital as an inpatient, Part A swoops in to cover a whole bunch of essential services. We're talking your hospital room, no, not the fancy suite with the jacuzzi, but decent accommodations nonetheless. Your meals, hospital food gets a bad rap, but hey, it's sustenance. And most importantly, the care of doctors and nurses working tirelessly to get you back on your feet. Part A also covers things like medications you receive while in the hospital, various tests and lab work, and even those stylish compression socks they love to give you after surgery. It's like having a financial guardian angel watching over you, making sure you get the care you need without worrying about every little cost. Section 3. Skilled nursing, because recovery takes time. Okay, so you've conquered the hospital stay, fought the good fight against whatever ailed you, but sometimes the road to recovery is a long and winding one. You might not be ready to bust out your best dance moves just yet, but you also don't need to be hooked up to a heart monitor 24/7. That's where skilled nursing facilities come in. Think of these facilities as halfway houses for your health. They provide a higher level of care than you get at home, but they're not quite hospitals. You'll have access to skilled nurses, therapists, physical, occupational, you name it, and even social workers to help you navigate the often overwhelming world of post-hospital care. And guess what? Part A has your back here too. It covers a certain amount of time in a skilled nursing facility if your doctor deems it medically necessary. Because let's face it, sometimes you need a little extra TLC and maybe some expertly guided physical therapy to get back to your old self. Section 4. Home sweet home health care without walls. Let's say you've conquered the hospital, rocked the skilled nursing facility, and you're finally well enough to head home. But maybe you're not quite ready to tackle stairs solo. Or maybe changing those pesky bandages feels like trying to solve a Rubik's Cube with one hand. Don't despair. Home health services are here to save the day. We're not talking about a full-time butler service, although wouldn't that be nice? Home health services are all about bringing skilled medical care right to your doorstep. This could include visits from nurses to check your vitals, wound care, physical therapy to help you regain strength and mobility, even help with things like bathing and dressing if needed. And yes, you guessed it, Part A often covers a certain amount of home health services if your doctor determines you need them. Because sometimes the best medicine is being able to recover in the comfort of your own home, surrounded by loved ones, and maybe a furry friend or two. Section 5. Hospice, comfort and dignity when it matters most. This next part is a little bit tougher to talk about, but it's important. Sometimes, despite the best efforts of doctors and nurses and the unwavering hope of loved ones, medical science can't work miracles. When a person is facing a terminal illness and a cure is no longer possible, the focus shifts from fighting for life to making the most of the time remaining. That's where hospice care comes in. Hospice is about providing comfort, dignity and support to both the patient and their loved ones during a difficult and emotional time. It involves a team of professionals who specialize in pain and symptom management, emotional and spiritual counseling, and providing practical support to families navigating this complex journey. Part A covers hospice care when it's recommended by a doctor because everyone deserves to face their final chapter with compassion, dignity, and as much peace as possible. Section 6. Part A. Costs, what to expect, what to watch for. Now, for the part you've all been waiting for, the money talk. Here's the thing about Part A. Most people get it premium free. Yep, you heard that right, free. That's because you've probably been paying into the system through Medicare taxes throughout your working years. Think of it as an investment in your future health and sanity. But hold your horses, free doesn't mean completely cost-free. There are still deductibles, a fancy word for the amount you pay out of pocket before coverage kicks in, and co-insurance, a percentage of the cost you share with Medicare. The good news is these costs are spelled out clearly each year so you're not caught off guard. And remember, Medicare is a big, complex beast, and sometimes even the savviest senior citizen needs a little help navigating the system. Don't be afraid to ask questions, compare plans, and reach out to Medicare experts if you're feeling overwhelmed. After all, knowledge is power, especially when it comes to your health and your wallet. All right, folks, we've tackled the big kahuna of Part A, your hospital hero. Now let's dive into the world of Part B, your trusty sidekick for all things preventative and beyond. Think of Part B as your proactive health partner, always on the lookout for ways to keep you feeling your best. While Part A is all about those big, scary hospital visits, Part B is here for the everyday stuff. Think doctor appointments, outpatient procedures, those pesky but necessary screenings, and even some fancy medical equipment you might need. It's like having a personal health assistant, minus the awkward small talk. Now, unlike its premium-free sibling, Part B does come with a monthly premium. But before you start sweating, remember, you've earned this coverage. Plus, the peace of mind, knowing you're covered for a whole slew of medical services, priceless. Let's be honest, nobody going to the doctor. It's right up there with filing taxes and listening to hold music. But regular checkups are like flossing, annoying but necessary. And that's where Part B swoops in, making those doctor visits a little less painful, at least for your wallet. Part B covers a wide range of doctor visits, from routine checkups with your primary care physician to specialist appointments for those more specific aches, pains and ailments. Got a bum knee that needs a specialist's touch? Part B's got you covered. Need to see a dermatologist about that weird mole shaped like a celebrity? Part B's on it. Now, keep in mind you might have to pay a copay or co-insurance for some doctor visits. But hey, it's a small price to pay for the expertise of a medical professional who can tell you if that weird mole is just a weird mole or something more sinister. Section 3. Outpatient care surgeries don't always need a sleepover. Sometimes you need a little more than a doctor's visit, but not quite a hospital stay. That's where outpatient care comes in, and thankfully Part B is a pro at navigating this middle ground. Outpatient care refers to medical services that don't require an overnight stay in the hospital. Think minor surgeries, procedures and tests. Did you know you can get your cataracts removed without spending the night in a hospital bed? Modern medicine is amazing. And with Part B, you can get those cloudy lenses cleared up without emptying your savings account. Part B also covers things like x-rays, lab tests, because who doesn't love a good blood draw? And even some therapies like physical therapy and mental health counseling. Remember, outpatient care can be a bit of a maze, so always double-check your coverage with Medicare and your healthcare provider to avoid any surprise bills. Section 4. Preventive screenings, catching things early is key. Remember that old saying, an ounce of prevention is worth a pound of cure? Well, it turns out that whoever coined that phrase was onto something, especially when it comes to your health. And luckily, Part B is a firm believer in the power of prevention. Part B covers a whole bunch of preventive screenings, those tests and exams that help detect potential health problems early on when they're usually easier and cheaper to treat. We're talking mammograms, colonoscopies, cholesterol checks, and even that delightful prostate exam that nobody enjoys talking about, but everyone over 50 should be getting. Catching things early means you're more likely to beat them, and that's a victory worth celebrating. So do yourself and your loved ones a favor and stay on top of those preventive screenings. Your future self will thank you. Section 5. Durable medical equipment, walkers, wheelchairs and more. Sometimes life throws you a curveball and you need a little extra support to get around, literally. Whether it's a walker to steady your steps after surgery, a wheelchair for long-term mobility issues, or a fancy oxygen tank to help you breathe easier, durable medical equipment can be a lifesaver, sometimes quite literally. And yes, you guessed it, our trusty sidekick Part B often covers a portion of the cost for these essential items. Now keep in mind, Medicare has specific rules about what equipment qualifies and how much they'll cover. So it's always best to check with them directly or talk to your doctor to make sure you're on the right track. But knowing that Part B is there to help you regain your independence and mobility, that's peace of mind worth its weight in gold, or at least the weight of a very sturdy walker. All right, folks, it's time for everyone's favourite topic, money. Specifically, how much Part B will set you back each month. Now, unlike Part A, which most people get premium-free, Part B does come with a monthly premium. But don't worry, it's not as scary as it sounds. The Part B premium is deducted directly from your Social Security benefits, so you don't have to worry about writing a separate check each month. And the good news is, the premium is based on your income. So it's designed to be affordable for everyone. Now, here's where things get a little trickier. Deductibles and co-insurance. A deductible is the amount you pay out of pocket for covered services before Medicare starts chipping in. Co-insurance, on the other hand, is the percentage of costs you share with Medicare you've met your deductible. All right, folks, buckle up. It's time to talk about the one thing everyone loves to hate: money. Specifically, how much this whole Medicare thing is going to cost you. Now, before you start sweating through your orthopedic shoes, remember, Medicare is designed to make healthcare, not bankrupt you before you can enjoy your retirement. But let's be honest, the world of Medicare costs can feel about as clear as mud wrestling in a snowstorm. You've got premiums, deductibles, co-insurance. It's enough to make your head spin faster than a disco ball at Studio 54. But fear not, my frugal friends. We're going to break it all down, step by step, so you can understand exactly what you're paying for and maybe even save a few bucks along the way. First things first, remember those two trusty sidekicks, Part A and Part B? Well, they each have their own little quirks when it comes to costs. Part A, your hospital hero, is generally premium-free for most folks. Hooray! But Part B, your partner in prevention, does come with a monthly premium. But hey, good things in life rarely come free, right? Okay, so you've heard me say Part A is premium-free about 1,000,000 times. And for most people, it's true. You've probably been paying into the system through Medicare taxes throughout your working years. But free doesn't mean cost-free. Enter deductibles and co-insurance. Think of a deductible like that annoying cover charge at a club. It's the amount you pay out of pocket before Medicare helps. For Part A in current year, that deductible is dollar amount. Once you've paid, then comes co-insurance. Co-insurance is a percentage of the cost you share with Medicare. Think of it like splitting the dinner bill with a friend, except your friend is the US government, and the lobster is your hospital stay. Section 3, Part B costs, premiums and deductibles. Oh my! Now let's talk about Part B, your partner in prevention. Unlike its premium-free sibling, Part B does come with a monthly price tag. But before you clutch your pearls, remember this covers doctor visits, screenings and medical equipment. The Part B premium is automatically deducted from your Social Security benefits each month. The standard Part B premium in current year is dollar amount. If your income is above a certain level, you might have to pay a higher premium. Just like Part A, Part B also has deductibles and co-insurance. You'll typically pay 20% of the Medicare-approved amount for most covered services. But hey, at least you'll be dizzy with health. Section 4. Navigating the maze, supplemental insurance and extra help. Okay, so we've covered the basics. Part A, Part B, premiums, deductibles, co-insurance, feeling a little overwhelmed. Yeah, that's a normal reaction, but don't worry, you don't have to navigate this Medicare maze alone. There's help out there in the form of supplemental insurance and government assistance programs. Think of supplemental insurance like that friend who always insists on splitting the bill evenly, even when you order just a salad and they get the steak and lobster combo. Medicare supplement insurance. Medigap plans are designed to help cover some of those pesky out-of-pocket costs that original Medicare doesn't, like co-insurance, co-payments, and even some foreign travel emergencies. And if you're worried about affording those extra costs, don't fret. There are programs like Extra Help that can help lower your prescription drug costs, and the Medicare savings programs that can help with premiums, deductibles, and even co-payments, because everyone deserves access to affordable healthcare, no matter their income level. Section 5. Don't be afraid to ask for directions, resources for Medicare. Help. Now, I know what you're thinking. This is a lot to take in. And you're right, it is. But the good news is you don't have to be a Medicare expert overnight. There are tons of resources available to help you every step of the way, from understanding your coverage options to finding ways to save money on your healthcare costs. First and foremost, there's Medicare.gov, your one-stop shop for all things Medicare. Think of it like WebMD, but instead of freaking yourself out with every possible medical diagnosis, you can actually get helpful information about your coverage. You can also call Medicare directly at 1-800-MEDICARE, 1-800-633-4227. Just be prepared for some hold music. And if you're more of a face-to-face kind of person, there are state health insurance assistance programs, SHIPs, all across the country that offer free personalized counseling to help you navigate the wonderful world of Medicare. Because sometimes you just need to talk to a real, live human being who can answer your questions without making you feel like you need a PhD in insurance jargon. All right, folks, you've made it through the Medicare jungle. You now know the difference between Part A and Part B, hopefully, and you're ready to finally ditch those confusing health insurance brochures. But hold your horses, partner. There's one more hurdle: actually enrolling in Medicare. Enrolling in Medicare is surprisingly straightforward. It's like signing up for a streaming service, but instead of binge-watching your favorite shows, you're signing up for access to quality healthcare. Section 2, help is just a phone call or click away resources to guide you. Okay, so maybe you're not exactly a tech whiz, or maybe you just prefer to talk to a real, live human being when it comes to something as important as your healthcare. No judgment here. First up, there's the Medicare hotline 1-800-MEDICARE. They can answer your questions and guide you through the enrollment process. Section 3. Welcome to Medicare. You got this! Congratulations, my friend, you've made it to the Medicare finish line, or maybe it's more like a starting line. You've learned about Part A and Part B and successfully enrolled in a Medicare plan. Now it's time to sit back, relax, and enjoy. You have access to quality healthcare. Live your golden years to the fullest. Now go forth and Medicare like a pro. Section 1, Medicare, your golden ticket to peace of mind. So there you have it, folks. We've journeyed through the wild world of original Medicare, from the ins and outs of Parts A and B to the perplexing maze of premiums, deductibles and co-insurance. It might seem like a lot to digest, but remember, you don't have to become a Medicare expert overnight. The important thing is you're now armed with the knowledge to make informed decisions about your healthcare. You understand the importance of those routine checkups, the power of preventive screenings, and the peace of mind that comes with knowing you have a safety net in case of unexpected medical bills. Remember those horror stories you hear about people draining their life savings to pay for healthcare? Well, with Original Medicare in your corner, you can rest assured that you won't be one of them. It's like having a financial guardian angel watching over you and making sure you can get the care you need without breaking the bank. Section 2. Welcome to the club. Enjoy those golden years. Think of Original Medicare as your golden ticket to enjoying those retirement years you've worked so hard for. It's your passport to peace of mind, knowing you can focus on the things that matter most, spending time with loved ones, pursuing your passions, and maybe finally writing that novel you've been dreaming about. No more stressing about surprise medical bills. No more putting off necessary procedures because you're worried about the cost. With Original Medicare, you have the freedom to prioritize your health and well-being without the constant worry of financial strain. So go ahead, embrace those golden years, travel the world, take up a new hobby, or simply relax and enjoy the simple pleasures of life. And remember, if you ever have questions or need a helping hand navigating the Medicare landscape, there are resources available to guide you every step of the way, because everyone deserves access to quality, affordable healthcare, especially those who have contributed so much to our society. Now go forth and Medicare like a pro. Need help? Reach out to us at medicarecoverages.com.